right. So you two came together, and what have you combined, added, taken? What's the experience now like?
Yeah. Okay, so what was great is we were already kind of going down that path. We knew that we had to actually add capabilities to reach the rest of the population. And so as we started down our own path of developing and building on the software we built, our thought was, wow, we could really accelerate this if we could work with someone who's creative, thoughtful, and has done this at scale. And that's when we turned to Sherpaa. So bringing Jay on board was an opportunity for us to really accelerate some of the thinking we already had, as well as accelerate the product development. So what Jay's doing for us is actually redesigning the platform that he built in a new implementation with crossover. And that's what we're so excited about, is to take the lessons learned over the last decade for Jay, the last decade for us, merge those together in a new software platform that we think is going to be out of this world.
Cool. So I want to ask you guys a couple of quick questions about business, but then I want to go into the interesting stuff.
Okay.
So you'd raised a decent chunk of change a while back, 90 million plus?
Almost 100 million, yeah, from Granite Point Capital.
Okay. And Jay, you raised some and you had some fun in the whole money raising. I remember it just got written up in Fast Company on your blog and elsewhere, I forget elsewhere, but there was some fun and games there. What was the deal between the two of you? Is this an equity deal? Did you acquire Jay's practice?
Well, both Jay and I, we have some scars to prove from our experiences with raising professional money, and so I think we approach this probably differently because of that. I knew Jay would add incredible value to our company, well beyond anything that we would pay for any assets of the company, and really it's his mind and his ability to execute is what we wanted in our company. And so we actually were able to build a relationship that allowed Sherpaa to become a part of Crossover, that put Jay in a position to continue to innovate on this platform with the millions of patients that we'll have, and it seemed to work out pretty well. So we love it.
Sounds fun. Okay. So Crossover today is how many clinics, how many patients, how many employees? Just give me the
Yeah. Well, roughly, we have about 35 clinics from coast to coast. We're taking care of almost 250,000 patients. And we're
how many MDs?
We have north of 70 MDs. We have about 700 people in the medical group and another 100 or so in the management group.
All right, so you're a pretty sizable group practice. You can out of nowhere.
We can't say we're a startup anymore.
Yeah.
If you don't catch up with us, you could say we're a success a decade in the making. So.
All right. So another of the kind of OGs of this, getting technology and helping out doctors, is a guy called Jonathan Bush, who made both of those.
I just saw Jonathan.
Yeah. Exactly. So I had him at Health Duper a couple of weeks back, and he was he's in a organization called part of the organization called Firefly, right?
Yeah.
That's how much. But he did say, that there's a way to go, right? He's something like, he said, if the 8 or 10 of us have got real, professionally managed sort of startup new full primary care organizations do it, we're still, 10% of the market. So, on the other hand, you've got the big healthcare systems continue to buy primary care doctors, feed the beast, surrounded. We just had Sutter in California have the lawsuit about pricing. We know that the flavor's gone there. What is your approach at Crossover to thinking about how do you manage the downstream part of primary health care where we spend all the money?
That's a great question.
Thank you. I'm an OG too. I've been doing this shit as well. Come on.
So really this is the big news from Crossover at this conference, is that we just introduced our connected system of health. And one of our clients, Comcast, will be implementing this system throughout the country, which was the really big news. But the insight we had, Matt, was exactly what you just said. Primary care, in and of itself, is about 15% of the spend of our employers. A full 85% of it happens outside of our four walls, beyond the reach of our care teams, and really beyond the view of the employers. But that's where all the money is.
Yeah.
So what we realized is that primary care needs to be a great foundation to build a relationship of trust, establish lines of communication, and then we need to be available to steer and navigate and guide you in the most costly, complex parts of the system. So what Crossover is doing, enabled by the technology we acquired with Sherpaa and what Jay is building, is to allow our care navigators to be embedded in with the primary care team, the care managers to be embedded, to embed digital health tools, and to go after the 85%. That's where our business is shifting, away from just primary care as a foundation to now managing an entire population, because the medical group now has more capabilities than it's ever had, along with being the most trusted entity in the system. And that's what we're banking on.
And what's crazy about that is, say there's a $100 million spend, there's an $85 million spend on secondary care, right? If primary care affects 17% of that $85 million, that pays for primary care.
Totally.
Right? So it's just like, risk, I mean, it's an interesting approach. Is it do we go after the 85 million of spend, or do we take on risk? Or do we do both? I mean, that gets really...
But you guys are already working for the employers who are on the hook for the whole amount,
That's
right?
exactly
Which is a different market. And
so
I was in a conversation between a couple other OGs, Farzad and Rashika, yesterday. Right? That was kind of fun, right? But they were going about, well, you know, do you have to do it, start again? And Rashika was saying, yes, you have to take the whole risk, which is back to your neighborhood at Friendly Hills in 1993, right? Maybe back to 1937 when Sidney Garfield started Kaiser, right? You take on the whole thing.
So here's what's so interesting. So first of all, I think Rashika was 100% right. Is that you can't mix these models. If you have fee-for-service incentives, you can't mix those with global risk. What we say is, look, you know, what's interesting is healthcare. You can always read the future. I can see what's going on in the Medicare Advantage space. I can see how Rashika and others are going after the global spend. The employers are going to get to the same place. They're paying for this, they're going to expect cost and quality, they're going to expect outcomes, and they're going to expect that we can manage the entire population spend. So we're gearing up for that day by adding an enterprise data warehouse, by being able to proactively and predictively reach out to the population. And what's so fascinating, as Jay knows, is now we have the platform that is in constant communication with you. Now I inject it with insights and intelligence, and I'm just that much more effective, because I do think the employers will get to the place where they're actually demanding, expecting to take on risk.
And cost awareness. If a doctor, I mean, I always say the doctor is the real consumer of healthcare. They're the ones ordering, you just do the paying, right? So it's like if a doctor's cost awareness, and also benefit aware. Say, for example, in our back end, we built, say, Facebook's profile, and now we start attaching benefits to Facebook. At any point in time, the doctor can pull up, well, what benefits are available to this person right now? What's the unique strategy that Facebook has in place that can direct my clinical strategy, right? So it gets, I mean, that's how we're going to start affecting that 85 million, that 85% of spend in a population. So.
Yeah, I mean, I think that has to be the way it's going. More, you know, how the last question is: so you're in the employer space, you may think about Medicare Advantage, or how do you convince more employers, and how do you scale it to smaller ones? So sorry, I'm in the healthcare block, there's only two of us. Maybe it's a challenge for us to put a clinic in, but forget that. But even the 1,000 and 2,000 person companies, how do you scale those guys?
I think it's a great question. It's fair. Like, if all we did was provide cool healthcare benefit and a service to these elite employers, we didn't really solve the problem we set out to solve. What we believe, though, is that it's a great place to innovate and to scale and develop a model, but this model has to be available to others to buy into. And this is really where we started going with the concept of a near site. I make a center available, it's exactly like the one on the Facebook campus, but now it's available to multiple smaller employers. Now, can I build a virtual model that does the exact same thing, so that the cost for us to incrementally add a 2 or 20 or 200 person life group is really zero, and because we already have the platform, we have the team in place and the capabilities. That's where this has to go, because I don't think Jay nor I are satisfied with just the slice of the pie that we're delivering today. We want to fundamentally transform healthcare, and to do that, you've got to get way beyond the employers, get into all kinds of different types of payers or any other risk-bearing entity, and I think that's where this is going. So our hope is to make the solution scalable so that you can join, because we'd love to have you as a member.
And you know what? If the iPhone had started with my parents, they never would have taken it. Right? So, I mean, and now you have $25 Androids, right? So in a lot of ways, you just have to start with a niche that gets it, right? And then, you know, it gradually, I call it trickle-down technology.
Okay, well, my hope is, I'll say you guys, my hope is that, so when I met these guys, they were pretty young. Actually, you'd done one start, you were just out of medical school, and I was feeling young too. I'm not feeling young anymore, it's been more than 15 years or so, but let's hope this gets done before we're all too old.
I agree.
Okay, right, I want to really thank Scott Shreeve, Jay Parkinson. It's been great to catch up with you guys. Congrats on what you've done, several crossover, and the Sherpaa now crossover. I look forward to seeing where it goes the next couple of years.
Okay, all right. Thank you, man.
Thank you.
Awesome.